Welcome to the Deep Dive. We take specialized sources, break them down, get you the knowledge you need. Today, we're looking at proactive health, specifically understanding the testosterone blood test, and really importantly, what those numbers actually mean for you.
Yeah, and for this, we're using a really specific source. It's a guide focused entirely on testing services in Great Yarmouth, which is great because it gives us that local angle. The info is tailored right to the clinics and procedures there.
Okay, and the website that comes from is Blood Test UK. So our job today is to, translate the science, make it simple, focus on getting the test right, and crucially, the big benefits of keeping an eye on your levels. All right, let's get into it. The test itself sounds pretty simple. Quick blood draw.
Oh yeah, very simple for you. Professional does it, takes maybe, less than 15 minutes. Clean the arm, sterile needle, bandage, done. The clinics there in Great Yarmouth really aim to make it smooth.
But the key part for you, the patient, is actually the prep beforehand. That seems critical for reliable results.
Absolutely critical. The timing and the fasting, that's what the guide really hammers home. You need clear numbers, so that means an 8 to 12 hour fast. Just water, no coffee, no food. And this is really important, test early in the morning, before 10 a.m. usually.
Why so early?
Well, testosterone levels naturally follow a daily rhythm. They peak first thing, test later, say in the afternoon, and your levels might look artificially low. That could mess up the interpretation,
Okay, that makes sense. You want the baseline, not the afternoon dip. The guide also mentioned medications. You have to tell your doctor everything.
Definitely. Full disclosure is vital.
Yeah.
The main worry is suppression. Things like opioids, even some antidepressants, they can push your natural production down.
So the doctor needs to know if it's a medication effect or your actual baseline.
Exactly. They need to know they're looking at your true physiological level, not something temporary caused by a drug. That conversation you have with your provider there in Great Yarmouth, just as important as the blood draw itself.
Okay, prep sorted. Let's talk about the payoff. You get the results back. What's the real value? Why monitor this proactively?
Well, thinking bigger picture, regular testing helps catch conditions like hypogonadism early. That's when your body just isn't making enough testosterone. And the symptoms aren't just feeling a bit tired.
Right, it's more serious.
Oh yeah, we're talking deep fatigue, bone density issues, metabolic problems, real mood swings. Catching it early guides the next steps, like lifestyle changes.
And the most immediate thing people probably feel is just better quality of life.
For sure. Getting those levels balanced can mean more energy, feeling more stable mood-wise, better sexual health. It makes a big difference day to day. The guide suggests men over 40 get checked every year or two, especially with symptoms.
What about younger guys? Do they wait for symptoms, or is there a case for checking earlier?
Generally, yeah, it's more symptom-driven for younger men. But there's a shift towards using it for optimization, too. The local angle here is interesting. The guide mentions athletes in Great Yarmouth using tests not just for problems, but to fine-tune training.
Fine-tune how?
Like checking morning levels, then maybe deciding to shift heavy workouts to the afternoon based on that data, helping them manage recovery, maybe get better muscle gains. It's about using the info personally.
Okay, that personalization is key. So pulling it all together, this proactive approach, promoted locally, it's about empowerment.
Totally. It's about giving you the knowledge, catching small things before they become big issues that really impact your life.
And when you get those results, what's considered normal?
That's a great question. The typical range is wide, like 300 to 1,000 nanograms per deciliter NGDL. But, and this is crucial, if your result is, say, 320 NGDL, technically normal.
Well, right, it's inside the range.
But if you're feeling awful tired, low libido, then 320 might be low for you. Don't just look at the number in isolation. The healthcare providers, they are ready to talk about what it means in your context.
So it's not just about hitting a specific number on a chart.
Not at all. It's about how you feel and function. The next steps, whether it's diet, exercise, or other treatments, should be tailored. And that personalized guidance available locally, that's the really valuable part.